is no shame if you cannot stop either street drugs or your pharmaceutical drugs cold turkey or all at once. Now, applying to pharmaceutical medications, you should always discuss with your doctor the best way to go off of it. And more than likely, they will always discuss and do a taper with you. Because as with things such as benzos or even antidepressants, stopping cold turkey can have some detrimental side effects. It can cause seizures, increased suicidal ideation, paranoia, intrusive thoughts. The list goes on. And people sometimes, unfortunately, end up in the psychiatric hospitals as a result of this. Now let's go to exactly what a taper is and how we're going to apply this to if you're using street drugs and you feel like you can't talk to a doctor about how to approach this, what a taper is. Now, by Google's definition, a drug taper means slowly decrease the dose of a drug over time to reduce the risk of withdrawal symptoms. By tapering off drugs or alcohol gradually instead of discontinuing use all at once, patients have the opportunity to focus on their treatment and begin the lifelong work of your recovery. Now, I read this just so you know it's out there, a taper. And I know you might go, what are you talking about? If I'm using, for example, street drugs, and you might go, now what are street drugs daily dose? Okay, I know I'm breaking it down like this, but obviously things like methamphetamine, heroin, and yes, there is pharmaceutical heroin in the form of pain medications, but we're not hating on it, we're just telling you. Now, let's real quick look at methamphetamine and heroin. If you, and this is kind of what I want to sum up with this, if you are shooting it, meaning that's pretty much the critical aspect in regards to, that's the hardest route if you're using it to get off of cold turkey. Because remember, when you are shooting a substance of any sort, it goes directly into your bloodstream, and it's an instant hit. And let me reiterate to some people out there that do say, well, why don't they just quit? Why don't they just quit? When an addict is shooting up drugs, it's not to get high. Let me say that again. It is not to get high. It's to feel normal at this point. If they could put it down, they would. See this all the time in the psychiatric setting. They want to get off of it. It's that hard for them. And yes, they have to make the decision for themselves to want to get off of these things. You can have family, friends wanting you to, but they have to. But unfortunately today, with how strong some of these street drugs have gotten out there and a lot of things being laced with fentanyl, that it's gotten harder than it has even 20 years ago. And then add things like cannabis in there as well, which, as we discussed in prior videos, you can check those out, being 30% just in the flower alone, and having these edibles with, having effects that aren't even like a normal cannabis high anymore, where you're having intrusive thoughts, paranoia. It's a whole new ballgame today. It's not the same as it was 20 years ago even. Now, if you're shooting anything up, don't be scared. I mean, once again, you're probably scared, but it's good you're watching this, because you don't have to go through this and think that you're going to be judged by everyone. What I've seen be more successful, and there might be, once again, people out there who don't agree with this, but if you are shooting methamphetamine, what I've seen work and people be successful with, if you're really wanting to quit, is going from shooting it to changing the route, meaning now go to smoking it or snorting it, preferably knowing that the stuff is not laced. Reason being, because if you can move from that shooting route to another route, yes, you will still have a withdrawal, obviously, when you're getting off of it in the end, but it'll make it a lot easier, because when you're shooting, you're using so much more of that dopamine in your brain, to where if you can transition off to it, to another route, it's not a direct hit on your brain, to where your brain is slowly recuperating, meaning you will withdraw while changing the route when you've been shooting it. Once again, when you're shooting something, a lot of times that's kind of like the finish line of how you're using that medication. That's That's just my own opinion on that. And if you're wanting to get off of it, transitioning and then going from maybe snorting it or whatnot to smoking it. And once again, I'm not a doctor, I'm an RN. I'm just telling you what patients have reported to me working, and we're just being straight up with each other on this. That's all this is. It's to help you get off of substances, because the end all goal is to get off of it, and from there have a recovery program like AA, NA, etc., etc. Going back to a normal way of living. And if you have to go to using something like Suboxone long term, in that you're having a better quality of life, that's great. There's no judging with that. But we got to make that transition off the shooting, because with that, hepatitis C in particular, having more problems, having necrosis, necrosis even or having necrotic tissue, for example, gangrene, even things like this, having really bad circulation, your vessels having really bad constriction, really bad discoloration, having peripheral edema, it's swelling in your extremities. There's so many problems that happen so much faster if you're shooting a substance. So if you can transition from shooting it to from there even smoking it, and then from there tapering, I feel you would have more success. I'll give you an example. I knew someone in the psychiatric setting who'd shot up multiple years of methamphetamine. They'd never been successful getting off of it, and then they went from, because they couldn't shoot up anymore, because they had no veins to shoot up in. They were shooting even between their toes, if that makes sense. That's how bad it was getting. They had no other places they could shoot up. They were like, I was considering shooting in my carotid. Yeah, that's what it was like. They couldn't find a spot. They went to smoking it. They weren't getting the desire they wanted, but it was still better than just feeling like straight crap. And then from there, they started smoking it for 2 weeks, and they noticed, because I'm going to give my veins a break. I'm going to give them a break. And I'll never forget when I was trying to start an IV on this patient as well, because they had to have fluids. When I was in the intake department, there was no place. It took forever to find a place to finally start an IV on them. But it took so many tries, and the veins, this person was in their 30s, and they had the veins of like an 80-year-old. They were rolling. It was horrible. They finally saw what kind of shape they were in, and that's what led them as well to just being like, I can't keep living this way, to going to smoking it. They come in again to the psych hospital a couple months later from there, and from there, they were ready to get clean. Their body, even though they came in to detox from that point, they had transitioned from from shooting up to smoking it, and then from there they were able to be successful to get off of it. When they left, they relapsed again smoking it, but the difference was they went through a withdrawal in the psych hospital, they left, but when they left this time, the patient said he got one more batch, smoked it, and he stopped from there, because what he did with that last batch was he tapered that last batch off smoking it, and from there, he was able to get off of it. He came back into the psych hospital again 2 months later, so this is over like a 5-6 month period, for having some suicidal thoughts. He got on an antidepressant, and from what I know, he's been clean ever since. So if you're in that situation where you're shooting something up, just know, and I'm not once again advocating for somebody to go from shooting something up to smoking something, but I'm just saying off experience, from a patient's experience, sometimes you got to kind of think outside the box, because unfortunately just quitting cold turkey, the relapse rate of that is so high. Some people might be able to, don't get me wrong. I'm just giving you alternatives to potentially how you could get off of this, because I'm sure a lot of you hearing this before have typed, how can I get off of shooting something up? I've tried recovery, I've tried inpatient setting, I've tried this, I've tried that. Maybe go back, think about how you started using the substance. Typically you don't go right to shooting something up. maybe to smoking, to snorting, then shooting, maybe trying the opposite effect to get back down to baseline. And then once you get back down to smoking it again, you taper it. You taper from when you get to that original point of smoking it again, and go from there, and then cold turkey it, or be better to cold turkey it once you get to that route of administration. I know there's going to be controversy with this, but once again, you gotta, sometimes in today's society, you have to think outside the box with this. And also, let's discuss one more thing with the taper that I want to get into, and I've done videos on this before in the past. If you are taking a benzo, once again, if you've been taking it for, multiple years, always discuss with your doctor a taper plan. If you have a doctor that's not willing to discuss a taper and they're going to pull it from you cold turkey, that's very dangerous. But the big importance in regards to why you would like, if you're trying to get off of those as well, and why you would want to taper them, the number one fact is seizures. Because when you're taking them, what essentially a benzo is doing is it's having an interaction in your brain with GABA. It's GABA essentially. It's attaching to that GABA receptor site, the GABA chemical in your brain, and from there, that's what's causing that relaxation. And sometimes there are some antidepressants as well that they think kind of have interactions with it, because there are some. The one thing about your brain you got to remember is this. For example, meth, dopamine, heroin can be dopamine, serotonin. But remember, in your brain, how it affects your brain chemicals, everything is, to an extent, interchangeable, meaning it can affect different parts of your brain. All of our brains are slightly different, to where some people might get effect from, for example, using meth, more of a serotonin, norepinephrine, and obviously dopamine, compared to somebody else who just get a dopamine effect of it, which would be like that runner's high feeling, that energy feeling. So just keep that in mind as well. But with benzos, everyone's GABA, that's the one brain chemical that will affect your GABA, which once you've been taking it, it'll be imbalanced when you stop. A lot of times a benzo, that's why you'd want to taper, to avoid the withdrawal effect, but also the potential of having a seizure. To where when you're getting off of it, avoiding a seizure, muscle spasms, and extreme dizziness, and like a blank, foggy feeling you could potentially develop if you did that cold turkey. If you taper it, you avoid all that. And the other thing is, once you have a seizure, if you stop at cold turkey, sometimes if you have a predisposition to having a family history of seizures, you can develop epilepsy from that. I've seen it. So do not stop cold turkey benzos. That's the number one thing out of pretty much all drugs in general and alcohol. You never want to stop either of those cold turkey. You always want to develop a taper. But tapers can be very useful for anyone out there, especially if you've never went through a withdrawal in general. A taper would always be the option if you're ready to quit. But if you've tried tapers and you've tried cold turkey and you're shooting up with, once again, the summary of this video, maybe reversing the way you originally started doing it, to shooting it, to smoking it, or snorting it, and then tapering from there to where you can avoid a lot of that harsh withdrawal effect. I wanted to clear that up just because, in general, reading more and more stories about the drugs on the streets today and how hard it is for people to quit, and there being such limited resources, that sometimes you've got to be the one to think outside of the box with it. Once again, I'm not a doctor, just reporting what patients have said have worked for them. That is your daily dose of mental health. We touch on topics that today aren't talked about enough, that can be controversial, but need to be discussed, because mental health problems, unfortunately, are on the rise, and drug addiction goes hand in hand with mental health. A lot of times what people use originally, it's because of having trauma or having a mental health problem in general. So like and subscribe. If you need help, don't be afraid to reach out. Leave a comment if you've had any problems in general with addiction, if you're having problems with it. But I'll just tell you, if you're willing to quit and you're willing to put in that work, it does get easier over time. And there are options like AA and NA, which I know personally have helped people tremendously and have kept people clean to this day. And just unfortunately, though, it does not work for everyone. Sometimes they've got to use other resources first, and then they can transition to that aspect of it. But love you all. Have a great rest of the weekend. Stay safe. Next video, we're going to be talking about we're going to be talking about something similar to Ozempic and some mental health problems with something like that, a medication like that, to where we're talking about something a little bit outside of mental health. And then I'm also going to be covering a mental health disorder. That's your daily dose of mental health. Like, subscribe, comment. Love you all. I know this was a little longer than I wanted it to be. Sometimes I don't have any script or anything. I just talk about what I feel is important, and there's no editing with it. Have a great weekend.